come with me. Hi everybody, we're going to work. We're having some most important presentations today. Policies, healthcare policies, clinical guidelines, part of health system strengthening. You all know that I'm super passionate about decentralized healthcare delivery models. The only way, I keep saying, the only way to achieve universal healthcare coverage is through the decentralized care and quality healthcare access, particularly in primary healthcare. If primary healthcare is widely accessible to the most resource constrained and just the resource limited, particularly the underserved communities, those that can't reach. I always say this. I even forgot. Anyway, it doesn't matter. I forgot something important. So my eyelashes young punk because I forgot my mascara. I was running a bit late, so I was just rushing through. I didn't do my full makeup, but it doesn't matter. I'll have to survive the day. I'll open my eyes very wide. Yeah, man. Healthcare coverage. Ish. I need my fingers to open the gate. Just a second. Yeah, so I'm talking to all of that today. It's matters that are very close to my heart. Decentralized care, prevention. I'm an epidemiologist, right? I'm an epidemiologist. We believe in prevention better than cure, because if we prevent diseases, there won't be a need to cure them. And we also believe that diseases or health events, they never occur at random. You don't just get sick because you're sick. Everyone gets exposed to a pathogen. Everyone would be exposed to something that make people sick, but not everyone is going to be sick. And among those that are sick, not everyone is going to be severely sick. Among those that are severely sick, not everyone is going to succumb or die from that health event or the disease. So our role as epidemiologists is to track the patterns of this disease so that we identify the cause. Most importantly, we identify the at-risk population of that health event or the disease. When we have that information, when we know the trends and the occurrence of the disease and when do they occur, which people are the most affected, at what point in time, when does it get to recur. So when we know the patterns, we definitely then are able to prevent it. So that's why I'm big on prevention, because it's our core pillar as epidemiologists. We are in disease prevention more than anything. We believe in disease prevention. If we prevent diseases, there won't be many people that are already sick from that disease, so there won't be a need for many people to be cured, provided we manage to actually prevent them. So that's why I'm very big on prevention. So today I am speaking on that, matters that are closest to my heart, decentralized care, because decentralized care, community-oriented approach, it allows us to strengthen the prevention and disease control. Those that are already sick from especially the non-communicable diseases like your diabetes, your hypertension, your mental health, cancers. Once we at least catch the disease early, we prevent the further devastation of that particular disease. We prevent a progression. So that's disease control. We control it now, right? So at first, the aim is to really prevent it, but to those that it had already occurred, because one way or the other is to some of us, then we control it. So if we are on par as a country, e-health system yet, if it prioritizes and invests and it's strengthened, it's so strong in primary health care, disease prevention and disease control, we won't see influx to the hospital. We won't have to spend much more billions in managing the complications and the disability that arises from the disease, because most people will be controlled, most people would have prevented, and they will continue to live healthy to further prevent the occurrence we want to invest so much in prevention such that there is far less occurrence of avoidable diseases, vaccine preventable diseases, or preventable diseases themselves, especially I mean the core thing about this whole, such a big pothole, I lost my train of thought. Anyway, decentralized care. Decentralized, if it's centralized, because currently when you're sick you need to travel to the clinic. If you are back home, there's one clinic per I don't know how many villages around that, and then although there would be clinics per village, it's not well equipped. You don't have the best expertise. Even though you have the best expertise, you don't have the best resources to actually deliver the expertise or the clinical actions. So clinics are forced to like refer most of the things to the hospital, and when we're referring to the hospital, then the hospitals are full because there's people that are walking into the hospital, there's people that are supposed to be in the hospital, but again there's this proportion of people that were supposed to be seen at a clinic level, then they are referred to the hospital. So that's why we see overwhelmed hospital. But if we empower our clinic services more than anything, if we empower our outreach, every hospital has clinics that falls under, and then I arrived, I'm at work now, I have to stop my talk. As soon as I park, the basement, it's so dark. Just a second. The basement is dark, wait, so I'll have to like just open a gate. So we'll have to stop talking. Bengitim na every clinic, every hospital in our clinics under it, right? That are referring to it, that they are supporting. And then every clinic, ideally, it's supposed to have outreach. Outreach is those teams that goes into the communities to bring the services, primary healthcare services, like your prevention, they're supposed to be found there, your STI treatment and testing, they are supposed to be found there, chronic medication, they are supposed to be found there, like screening of diseases, like simple diseases, they're supposed to really be found there. But it's not always happening like that because of a lack of primary healthcare, primary healthcare empowerment. Primary healthcare yet is not as empowered to carry out that. But imagine in a best world, Njengo Rwanda, Njengo Cuba, where primary healthcare is the thing, is the cornerstone of the healthcare system. Then you don't have to go to the clinic for HIV, for ART, or for your PrEP, or for your contraceptives, or for your STI screening. We know that 75% and more of STIs among young people, they are asymptomatic, so they don't even have signs and symptoms. But due to your risk behavior, due to your, you know, by proxy that I might actually be exposed, depending on how much condomless sex do you have with people that you don't even know their status, right? So people that are at risk, like healthcare workers, not healthcare workers when it comes to STI, I'm talking about sexual workers. We have key population, adolescents and young people, people that are pregnant, you know, those are the people that those services that they need, they don't really have to travel and go queue in a hospital. Outreach, if they were well empowered, primary healthcare too, if we were able to bring these primary healthcare services to the people in the communities, then the people from the communities are not forced to go queue in the hospital clinic, because also the healthcare system, our clinics and hospitals, they are so much associated with disease. So people, they feel like I'm not sick enough. Even if you're not sick, you don't have any complaint, you just want screening and stuff, there's no, you can be prioritized because there's more urgent things like people that are more sick. So outreach, primary health care is allowing us to push our prevention. A community oriented approach or community based prevention or decentralized care service delivery, it allows us to invest so much in our people's healthcare prevention. So we won't be seeing influx to the healthcare system, we won't be seeing influx to the clinics, to the hospital. If we empower our back to basics, our outreach needs to be empowered. Primary healthcare is the cornerstone, but now we are reactive. We are not proactive as a healthcare system in South Africa and in most African countries. We are so reactive. We wait for disease to occur. We invest so much in tertiary healthcare. We invest so much in specialized care, and neglect the primary healthcare. So we so much focus on waiting for people to get sick and then come, and then we're gonna cure them, and then we invest so much in curative medicine, not so much in preventative medicine. So again, my passion is we need to push both, but we need special attention and investment in primary health care, in preventative care medicine, because we won't have much burden in curative care medicine if our preventative care medicine is prioritized, is well resourced, is well empowered. So back to our outreaches, back to our community healthcare workers, and you know, the PHC nurses, they're doing the things. Most my colleagues over there, they're doing the things primary healthcare, and there will be like doctors that are supporting them as well. And you know, but yeah, we need that model back, you know, because we are in a chaotic state now in terms of the diseases in South Africa. So the only way to reach universal healthcare coverage, which talks to equity and equitable access, so people that they need to receive accurate and high quality healthcare delivery regardless of where they stay. So people in remote areas, they don't need to travel to town to get quality healthcare services, you know. So our outreaches, community-based healthcare delivery is going to give us the decentralized care, decenter healthcare service delivery. Hi, let me get in. I'm going to present now. Wish me luck. Okay. Yo, my hair has some misbehave. Buga on the mirror. I'll do this here. I'm so tired from walking up the stairs. I'm not a fan of walking. I'm just not a fan of walking. Kodwa mangena up, I have to walk 2 floors up. So I'm already exhausted. I'm hyperventilating. But let's do this. More than ready for my presentation. Let's go. I'll show you a bit.